Hi, I'm Jason Salemi. I'm an associate professor of epidemiology at the University of South Florida College of Public Health. And some interesting things have transpired in the last 24 hours. As you may have heard, there was a little bit of a mix up in the CDC's representation of new cases reported in Florida over the past weekend. And so, to make a very long story short, in the process of updating those numbers, the Florida Department of Health appears to have released a full time series to the CDC that gives the new cases based on the date that the individual tested positive and became a case instead of the date reported, which is what is more common. And even more interestingly, it looks as though the update on new deaths on each day has now made it a deaths by date of death record instead of a deaths by date reported, which of course is something that we used to get and is much more meaningful. And so I'd like to just take this opportunity to utilize that data to demonstrate the impact of COVID-19 vaccines on deaths among Florida residents. Admittedly, this is a very superficial analysis, but I also think it's a pretty powerful analysis. So what I basically want to do is I've plotted now using that deaths by date of death information that was just released by the Florida Department of Health. I'm using the 7-day moving averages. That is the purple line that you see on this graph. And I just want to point out a few different points during the pandemic. And I want to compare and contrast them, pre-vaccine to post-vaccine, to demonstrate what we're seeing in terms of deaths. And then specifically more recently with the increases in hospitalizations due to the Delta variant, just what we can expect in the coming days. So I'll try and move through this relatively briefly. So obviously we had a summer surge in 2020. And so I've picked this particular 2-month time frame from July 6th, 2020 through September 6th, 2020. And you can see in terms of deaths, this is pretty much our most pronounced peak in terms of deaths. We had 63 individual days in this window that I'm showing you. During this window, there was an average of 169 deaths that were occurring each day. Only 2 days within this 63-day window were we not over 100 deaths for that day. And 21 different days within this window, we had 200 or more deaths that were recorded. The highest single day of deaths that was recorded, again, this is not 7-day moving averages. This is based on an actual day. On July 31st, we had 236 deaths that occurred on this day among Florida residents. That remains the highest individual day in terms of mortality from COVID-19. And just during this window, the highest single day of cases among Florida residents was 15,130 on July 11th. So just keep these numbers in mind. Obviously, a lot of times we were seeing a high number of deaths. So if we move now to the winter surge, so I've chosen the time period of December 14th, 2020 through February 22nd, 2021. There were 71 days within this particular time window, and relative to the 169 average daily deaths, we had a little bit fewer in this window, 150 average daily deaths. But again, only 2 days in this 71-day window did we not see over 100 deaths in that day, and 6 times we saw 200 or more deaths. The highest single day was 215 deaths that occurred on January 22nd. And in this case, we did see more cases emerging during this particular surge in the winter. The highest single day was the only day up until recently that we had exceeded 20,000 deaths in terms of the date that they actually tested positive and were added as a new death. And that happened on December 31st. So now we shift more recently during kind of the vaccine era. And this is when vaccines were really ramping up and being administered. We had targeted, even prior to this window, healthcare professionals and seniors, but this is when we really had a lot of vaccines being administered during this time frame. And so we had experienced a decrease in mortality. There were 98 days in this window of interest. We were averaging 56 daily deaths that were actually occurring. And 63 times out of these 98 days, we exceeded 50. So obviously, I'm not doing 200 or more deaths like I was doing in the previous two windows, but because deaths were lower, we experienced 50 or more deaths 63 out of 98 times in this window. The next period is basically when we started to see a little bit of an effect of Delta, but really before it ramped up considerably. That really started in early July. But this window that I'm including is June 1st to July 18th. There are 48 days in this window, and really, the lowest number of deaths that we had been, seeing in a long time, 32 average daily deaths. And unlike the previous window where we saw 63 of 98 days, we observed 50 or more deaths. Now, in only 2 of 48 days, did we see 50 deaths or more. And so the last window is July 19th until August 4th. And admittedly, we are clearly going to see more deaths within this window emerge because of the lag in death reporting. But just look at the contrast. There are only 18 days in this window, but we've now moved from 32 average daily deaths to 66 average daily deaths. And every single day within this window, we've seen 50 or more deaths. Again, contrast that to only 2 in 48 days in the previous window that we had 50 or more deaths. Again, even though we expect these numbers are going to increase because of the lag death reporting, all 18 days in this window, the most recent window, have we seen 50 or more deaths. And of course, during this particular small window of 18 days, whereas we had only exceeded 20,000 cases one time previously, we've now exceeded 20,000 cases 5 times in this small window, with the highest being almost 24,000 cases on August 5th. And before you say, oh no, I'm looking in the data set and that actually occurred on August 6th, that's when the information was reported. But based on my reconciliation of the weekly reports from the Florida Department of Health, I'm confident in saying this actually occurred on August 5th, not August 6th. So again, just the difference between when these events occur versus when they're actually reported. And so I mentioned this was going to be the impact of the vaccine. So again, superficial analysis, but here's what I want to demonstrate in each of these windows now. So in the summer surge of 2020, I look back at the hospitalization data. And even though we only started to see hospitalization data being reported on July 15th, from July 15th until September the 6th, the average number of adult patients currently hospitalized with COVID-19, confirmed COVID-19 on a daily basis, was 6,683. So if we just, again, crudely divide 6,683, the average number of adults sitting in the hospital with confirmed COVID-19, divided by the average daily deaths during this time interval, we get 40. Basically saying that it took about 40 adults being hospitalized on average each day with confirmed COVID-19 to yield 1 death. Okay, so clearly the higher this number is, the better. That means more people are being hospitalized relative to the number of deaths that we're seeing. The lower that this number gets, the worse off it is. So just keep in mind 40. Okay, as we look at the winter surge and do that same analysis in the red box, we had on average in this 71-day window, 6,185 adults currently hospitalized with confirmed COVID-19. If we now take the ratio of that number divided by the average daily deaths in this window, the number is 41. So again, approximately 41 adults currently hospitalized with confirmed COVID-19 to yield 1 COVID-19 death on average. So very similar to the summer surge. Both of these periods are largely before the real effect of the vaccines, even though part of this window falls within the vaccination era. But now let's see what's happened more recently. So in this next time window, again, 98 days in the window, this is when we were heavily vaccinating. A lot of people in Florida had really good vaccination rates. We had 3,106 average daily adults currently being hospitalized with COVID-19. If we divide by the average deaths in this window, now we're increasing. 55. It's not 40, it's not 41. So again, for the same number of hospitalizations, we're realizing fewer deaths. This is when we were also shifting the age distribution of hospitalized patients to younger ages. But obviously, we continued to do that because by June and July, our vaccination numbers had increased even more, even though the the weekly doses of vaccines we were administering had started to slow down, we've got a lot of our population during this window that has been fully vaccinated. And so, again, hospitalizations were relatively low. We were averaging about 2,100 adults currently sitting in the hospital with COVID-19 during this window. And when we divide that by the average daily deaths of 32, now that number is 66. So again, the number increasing is a good thing. It means for the same number of hospitalizations, we're realizing fewer deaths, or it takes more hospitalizations on average to yield a death. And in this most recent time frame, again, admittedly, the deaths are underreported during this window. They are going to increase because of the lagged reporting. But just to give you an idea, obviously, the scary thing is we've had a lot more hospitalizations of late because a lot more people are getting infected with this Delta variant. But if we, divide the average adults currently hospitalized each day, that's about 8,400 during this 18-day window, divide by the 66 average daily deaths, and the number is well over 100. Again, I expect this to come down, but I don't think it's going to come down that much. And I think it's ultimately why, where even though we're seeing record numbers of cases, record numbers of people being hospitalized, because we have shifted that age distribution, it's unlikely, unless the hospitalizations really get out of control, it's very unlikely we're going to see anything near the summer peak in deaths from 2020. It's just very unlikely that we're going to hit that high because we are protecting mainly seniors because the highest vaccination rates are among our senior population. And so again, I don't mean to lessen the impact of hospitalizations. If you have to be hospitalized for something, obviously your condition is severe. And even though you don't die, it doesn't mean that you're not going to have long-term ramifications from COVID-19. But I've heard a lot of people speculating as to, well, why aren't the deaths much higher? And I've always been cautious about analyzing the data because we only had deaths based on when they were reported, not when they occurred. And so this little mix up with the CDC and the revised reporting, it now looks, we won't continue to have it this way, but it looks like at least for this one data dump, we have deaths based on when the deaths actually took place. And so that allowed me to just take a little bit of a deeper dive into this and just to demonstrate what we all know the vaccines have been doing is because the group that is most protected through vaccines are our seniors. We are seeing younger people on average being hospitalized. We're seeing a younger age at death, but that ultimately means that for the same number of cases, for the same number of hospitalizations, we should be realizing fewer deaths because seniors in our populations are largely being protected through full vaccination. So again, I apologize. I know this is very, very crude. I just saw the numbers tonight, so I thought I'd look at them, and when I looked at them, I thought I'd throw something together that might just demonstrate how valuable these vaccines have been. Because think if this was summer of 2020 and we didn't have the vaccines and we were seeing these record numbers of hospitalizations and cases, obviously the situation would be much more dire because we wouldn't be able to protect seniors as much as we have been able to with the vaccine. So hope all of this makes sense. I'll probably be digging into this a little bit more in the future, but I know a lot of people have been asking questions, and so I thought I'd throw together just a quick video to discuss what I'm seeing in the data. All right, take care, everybody. Talk to you soon.